Most people see a dark neck and assume it's something simple, something a little embarrassing, something cosmetic, something that probably happened because they didn't scrub properly, or because their skin got dirty, or maybe because they just haven't found the right product yet, so they respond the way most people would. They exfoliate more, they use stronger acids, they scrub harder in the shower, they try brightening creams, body peels, cleansing brushes, and whatever else promises to make the skin look even again. And for a while it feels logical, because if something looks like it's sitting on the surface, then naturally you try to remove it from the surface. But then something strange happens. Nothing really changes. Or worse, it becomes one of those things that slowly gets more noticeable over time. Not dramatic enough to feel urgent, but persistent enough to stay in the back of your mind. And that's usually the moment when a cosmetic problem stops being cosmetic. Because sometimes what looks like a skin issue is not really a skin issue at all. If it were just dirt, it would wash off. If it were just poor hygiene, it would respond to cleaning. If it were just superficial pigment, it wouldn't feel different when you touched it. But this kind of change doesn't behave like that. It tends to appear in the same places. It often has a texture that feels slightly thicker, and it doesn't usually show up overnight. It develops gradually, almost quietly, until one day the person notices that the skin no longer looks like the skin around it. That's the part many people miss, because the body often reveals internal stress in subtle ways first, not through pain, not through obvious disease, but through patterns. And skin is one of the places where those patterns become visible earlier than people realize. So if the darkening doesn't wash off, if it keeps returning, if it feels different rather than simply looks different, then the real question is no longer, what should I put on it? The real question becomes, why is the skin changing like this in the first place? This is where the entire interpretation changes. Because for many people, a dark neck is not primarily a problem of cleanliness, and not even primarily a problem of pigmentation. It may be a sign that the skin is responding to signals coming from deeper metabolic changes inside the body. That's the shift. You stop looking at the neck as the cause and start seeing it as the display. You stop treating it like a stain and start understanding it as a message. And once you see it that way, the whole situation becomes much clearer. Because the body rarely begins with diagnosis. It begins with adaptation. And adaptation leaves traces, sometimes in energy, sometimes in weight distribution, sometimes in menstrual changes, and sometimes in the skin. There is a medical name for the pattern many people are seeing here, Acanthosis nigricans. And what matters is not just the name, but the pattern it describes. This condition is not defined by color alone. It's usually defined by three things happening together. The skin becomes darker, the skin becomes thicker, and the texture becomes soft, velvety, or slightly raised in a way that feels different from normal skin. That combination matters, because ordinary tanning does not usually behave this way. Ordinary surface buildup does not usually behave this way. And regular post-inflammatory pigmentation does not usually create the same thickened, velvety feel. It also tends to appear in predictable areas. The back of the neck is one of the most common. Under the arms is another. The groin can be involved. And in some people, similar changes show up over the knuckles, elbows, knees, or inner thighs. Not randomly, but in patterns. And in medicine, patterns matter far more than single isolated details. In most cases, Acanthosis nigricans is associated with insulin resistance. That phrase gets used a lot now, but many people still don't fully understand what it means. Insulin resistance does not mean the body has stopped making insulin. In fact, the body is often still making plenty of it. The problem is that the cells are no longer responding to insulin efficiently. So the body compensates. It produces more. And if that state continues long enough, insulin stays elevated in the bloodstream far more often than it should. That matters because insulin is not just a blood sugar hormone. It is also a growth signal. And once that signal remains high for long periods of time, it starts affecting more than glucose metabolism. It begins influencing tissues that were never meant to be under constant growth stimulation, including the skin. This is the part that changes everything once you understand it. Most people think of insulin in only one way, as the hormone that helps move sugar out of the blood. That's true, but it's incomplete. Insulin is also part of a much larger signaling environment in the body, one that influences growth, storage, and tissue behavior. Under normal conditions, that system works well. You eat, glucose rises. Insulin helps move that glucose into cells. Energy is used. The signal comes back down, but modern life makes that cycle far less clean. Frequent refined carbohydrates, sugary drinks, liquid calories, constant snacking, poor sleep, stress, weight gain around the abdomen, low muscle mass, chronic metabolic overload, all of these can push the body toward repeated insulin spikes. And when that happens again and again, cells become less responsive, so the body produces even more insulin to compensate. At that point, insulin is no longer just managing meals. It becomes a constant signal in the background, and over time, that signal begins interacting with growth pathways, especially those involving IGF-1, or insulin-like growth factor 1. IGF-1 is a powerful biological signal for cellular growth and proliferation, and in the skin, that matters. Because skin cells respond to these signals, they begin to grow more, they thicken, their architecture shifts, the surface changes texture, pigment becomes more visible, and the skin slowly takes on that darker, thicker, more velvety appearance people notice on the outside. So no, this is usually not something sitting on top of the skin. It is often the visible result of a signal that has been repeating underneath it for a very long time. So what you're seeing on the neck is not random. It is not meaningless, and in many cases, it is not the first problem. It is the first visible problem. That distinction matters because once the skin changes are noticeable, the internal metabolic pattern has often already been present for quite some time. The skin is simply revealing it in a form that the eye can finally recognize. And that's what makes this so important. Not because every dark neck is dangerous, but because some dark necks are biologically informative. They tell you the body may be struggling with something long before blood sugar reaches diabetic levels, long before a formal diagnosis, and long before the person feels sick. This is why people with this pattern often describe very similar things. They say the neck looks darker, but it never fully washes off. They notice that the skin feels a little thicker when they run their fingers over it. They sometimes realize that the underarms have similar darkening, or that the groin area has changed in a comparable way. Sometimes small skin tags appear nearby, which can also be a clue that the same insulin-related environment is affecting the skin more broadly. And often these skin changes do not appear alone. They may sit beside other subtle signs that seem unrelated at first. Weight gain, especially around the waist. Fatigue that feels vague and hard to explain. More cravings for sugar or carbohydrates. Difficulty losing weight despite effort. Irregular menstrual cycles in some women. Signs of PCOS in others. A family history of diabetes, obesity, or metabolic disease. None of these on their own always mean the same thing. But together, they start to form a pattern. And good medicine is often the art of seeing patterns before they become pathology. Now, this part is important. Not every dark neck is Acanthosis nigricans. Not every dark patch means insulin resistance. And not every pigmentation change carries the same implication. Sometimes it really is friction. Sometimes it's chronic rubbing. Sometimes it's sun exposure. Sometimes it's post-inflammatory change. Sometimes it's poor barrier function with surface buildup. Sometimes it's related to medication. And in much rarer situations, it can be linked to more serious underlying disease. But those patterns behave differently. They respond differently over time. They don't always create the same thickened texture. They may improve more easily with surface care. They may not appear in the same characteristic distribution. That's why doctors don't diagnose this from color alone. They look at texture, location, progression, associated symptoms, body habitus, hormonal context, and the broader metabolic picture, because skin by itself is only one part of the story. And this brings us back to the reason scrubbing so often fails. It fails because you're trying to remove what isn't actually removable from the surface. You're not cleaning off dirt. You're looking at skin that has changed structurally. The epidermis has thickened, the signaling underneath has shifted, the biology of the skin is not behaving as it used to. So every attempt that focuses only on the top layer tends to disappoint. Sometimes it causes irritation. Sometimes it worsens inflammation. Sometimes it makes the person feel more frustrated because they start believing they simply haven't tried hard enough. But effort is not the issue. Direction is. When the problem is being driven from beneath the skin, the answer cannot live only on top of it. This matters because Acanthosis nigricans can be one of the earliest visible signs of metabolic dysfunction. Not necessarily diabetes yet, not necessarily severe disease, but often a state in which the body is already compensating, and compensation can go on for years before collapse. That is true in dermatology, it is true in metabolism, and it is true in aging more broadly. The body protects function first. Symptoms usually come later, so by the time many people are officially diagnosed with something like type 2 diabetes, insulin resistance may have been building quietly for a very long time. And the skin may have been trying to say that long before the lab result did. If this kind of skin change developed gradually over years, especially with weight gain or other metabolic signs, then insulin-related causes become more likely. But there are situations where proper evaluation becomes more important. If it appears suddenly, if it spreads rapidly, if it looks unusual, if it is severe despite a lean body habitus, if there are other unexplained systemic symptoms, or if the person has no obvious metabolic context at all, that does not mean panic, but it does mean the pattern deserves respect. Because while the common explanation is often metabolic, the uncommon explanations are the reason good clinicians do not dismiss dramatic or atypical cases. So what helps? There are two levels to that answer. The first is local. Topical treatments can absolutely improve the skin's appearance and texture. Retinoids can help normalize turnover. Lactic acid can soften thickened skin. Glycolic acid can improve roughness and pigment irregularity. Urea can reduce excessive thickening and dryness. In some patients, these make a meaningful cosmetic difference. But local treatment is not the same as root treatment, because if insulin remains chronically elevated, the signaling environment that created the problem is still there. So the second level is systemic, improving insulin sensitivity, reducing visceral adiposity when present, building muscle, improving meal structure, reducing excessive refined carbohydrate load, sleeping better, managing stress more effectively, evaluating glucose, insulin, HbA1c, and hormonal factors when clinically appropriate. That is where the true intervention lives. And in many cases, once the metabolic environment begins to improve, the skin gradually improves with it. Not always immediately, not dramatically overnight, but often meaningfully, because the skin is no longer receiving the same signal. And that is the real insight here. Once you see that, the question changes. You stop asking, how do I remove this? And start asking, what is my body trying to show me? That is a very different level of awareness. And it usually leads to much better decisions. Because the body rarely begins with symptoms, it begins with patterns, quiet patterns, gradual patterns, easy to ignore patterns, until they aren't easy to ignore anymore. And sometimes what looks like a cosmetic inconvenience is simply the first place your internal biology became visible. Not because the body is failing, but because it is responding. And if you learn to read those responses early enough, you may understand the problem long before the damage becomes irreversible.